Similar to psychiatric diagnoses, individuals who do not understand my conceptions of the need for a paradigm shift in the field of mental health are prone to ascribe labels. The common label I have received is to be part of anti-psychiatry. First, similar to Lang, I do not deny the value of aiding individuals undergoing mental distress. Rather, I disagree with the means to carry this out, and am opposed to means that would be oppressive, forced, coercive, or does not respect the autonomy and dignity of the individual. It is my view that merely seeing the emotional world of individuals as chemical accidents rather than examining experience is a misguided and mistaken approach. Thus, I can view current psychiatric practice as akin to a materialistic religion, and it often has become the replacement for spirituality today. My other objection comes in that whereas we may find things to have an evidence base, we also need to be reality-based, that science must always be tied with ethics, and the premise of to first do no harm. Because we can validate something does not always mean that it's ethical and good. What has become particularly distressing is to see within psychiatric practice that a 10-minute or less interview with information solely obtained from sources who in some instances may have their own agendas can produce lifelong labels and scripts for often very dangerous drugs. Are we expecting that this type of so-called treatment is supposed to evoke some sort of cure? To whose benefit is this sort of treatment? And what do we expect the exact outcome to be? Where is experience heard in the midst of this so-called treatment? It appears that the child who has been abused has only been abused further by the system under the guise of help, and the bottom line is money. The complaint has always been that psychotherapy and human services are costly and time-consuming, but what we fail to realize is that these toxic psychiatric drugs are not only expensive in themselves, but expensive in their cost on human lives. To actually address the core root of a child's distress may take some time, but would produce an outcome far better than making the child a lifelong mental patient required to take toxic drugs for an indefinite period of time. It's also unfortunate that disadvantaged families are often lured into the psychiatric system because for many it's seen as one of few ways out. The government provides money for a psychiatric diagnosis. It's cheaper to pay out these checks than to actually really invest in programs that would address the needs of children and tackle issues of poverty and social injustice. And yes, there sadly do exist some parents who in selfishness would prefer to have their child considered to be incapacitated, though they are not, than to actually address the reasons for their distress. The entire mental health system must be deconstructed. The medical model must vanish, and it needs to be replaced with a model of compassion which takes into account the experiences of individuals and which ties science with ethics. And maybe then that we have a system that's humane, and abuses, for once, might actually become a thing of the past.